Croeso, Bwrdd. Good morning, welcome everybody. Delighted to welcome you to this, the third public board meeting of Digital Health and Care Wales, following our establishment on the 1st of April, which allowed us to get up and running as a new special health authority in Wales. I'd like to extend a warm welcome to all board members and those members of the public who are tuned into this live stream today. Due to the current advice from Welsh Government in relation to working from home, social distancing and so on, we are continuing to undertake our board meetings in a virtual environment, but we will continue to review that arrangement as advice changes, and it's possible that by the time of our next board meeting we will be doing things a little bit differently, but we'll have to wait and see. In the interim, obviously members of the public and stakeholders can follow the proceedings of the board meeting from our live stream, and if you're not able to do that live, you can connect in after the event to our YouTube site to pick the proceedings of the meeting up from there. We are expecting a number of stakeholders to join in the meeting today as observers via the live stream, and that's great. We welcome all comers, so I'd like to also extend a welcome to anybody who may be observing the meeting today or who watches the meeting after the proceedings have concluded. Specifically in relation today, I'd just like to note a couple of things. Firstly, I'd like to welcome our new associate board member for trade unions, Andrew Fletcher. Andrew is watching the live stream today as part of his induction process onto the board, and I'll touch on that a little bit later in my chair's report. Andrew formally starts with us on the 1st of April in this new role, but it's a great pleasure to welcome Andrew today, and it's another piece of the governance arrangements in place for the new board and the new SHA. Just to, again, I think I remind folks of this every time, that if we are, those of us who are speaking, if we're looking down and we're not looking directly at camera, apologies, but it is necessary obviously to be looking at papers and reading things at the same time. So if we're not always making eye contact, I apologise, but I'll do my best to do that. Logistics, we are scheduled for a couple of comfort breaks during the course of the meeting. I am aiming, and I'm hopeful with the agenda that we've got and the papers today, that we will be able to conclude the meeting by 1 p.m. at the latest, but we have got a couple of short comfort breaks scheduled in after parts 4 and part 5 of the agenda. Okay, in terms of the agenda itself, board members, as you'll be aware, the first section of our agenda is the consent agenda, where we seek questions in advance on any papers, and they will have been addressed offline by the relevant officer lead. I don't go through them in this meeting. They've been shared prior today, and will be available under our sort of admin control system and shared separately with the public in terms of an appendix to our minutes when we publish those. I'm not aware of any other questions that have come in today, and that enables us to move quickly on to some of the main items on the agenda. In terms of the preliminaries for the meeting, in terms of apologies for absence, I've only got one, and that's to note that Rachel Powell, our Deputy Director of Information, has given her apologies today. In terms of declarations of interest, there is just one I wanted to note today. Riddian Hurl, our Medical Director, has included in his register of interests that he is married to a general practitioner. It's relevant in terms of the item 5.3 on our agenda today, which is a contract award around the new GP systems. But having had discussions on that, Riddian has not been directly involved in that process, and therefore, in my view, there is no barrier to him fully taking part in that conversation today. But I'm grateful to Riddian for highlighting that declaration of interest, and we need to record that for the record. There are no matters arising that I'm aware of, unless anybody wants to raise anything with me from the minutes last time. And if not, I'll go straight onto the consent agenda. As I've said, we try to make sure that we focus our attention in the meetings on the key issues for the moment. I'm not aware that anybody wants to take anything from the consent agenda onto the main agenda, but I will just pause for a moment to see if any board members want to raise any issues. No? Okay, well, on that basis, I will move us quickly through the consent agenda. So what I just need to do for the record is to note that we are approving the minutes, item 2.1, from the board meeting which was held on the 27th of May. We are noting as a board the action log, item 2.2. There were 2 actions completed from the previous meeting, one relating to inclusion of performance reporting in a board development section, and 2 actions which are underway, so noting the action log. We're also noting the contents of the forward plan, because that has had some further updating between our board meetings. We are noting the All Wales policy that has been agreed through standard process around the respect and resolution arrangements, and that moves forward for us now for implementation with the organisation in line with other NHS bodies in Wales. And we are noting the annual plan 21-22 update report, because you will remember from the previous meeting that there were a few comments we had back from Welsh Government in relation to the report. There weren't many, and there is an update there with the responses that we've given to Welsh Government. So we don't have to reapprove the whole plan. It's just noting the small number of updates that we've made to that following dialogue with Welsh Government. So if everybody is okay with that, I will take us now on to the main part of our agenda, and the first item today is new for us, and I'm delighted to introduce this briefly. In common with, I think, the vast majority of NHS bodies, we agreed at our last meeting on the 27th of May that we wanted to use at least a part of our board agenda to listen to stories, feedback in relation to items that are relevant to our core work around taking forward digital transformation and the improvement of health and care services and outcomes in Wales. So as part of our approach to become a learning organisation, we want to get direct feedback from people who are involved in those changes, from users, from staff and so on. So today we've got the first of those, and I'm going to invite Iridian Hill, our medical director, to just make some initial introductions to our colleagues Cheryl, Effie and Gareth, who are with us today and who are going to take us through a short presentation around choose well, choose pharmacy. But Iridian, I'll hand over to you first of all for your introduction, and then we can move on through that item.
Thank you very much, Bob. Thank you very much, Bob.
Yep.
Good. Welcome, everyone. I'm delighted to introduce this item to the board. Choose Well, Choose Pharmacy is a great example of digital innovation and service transformation. The Choose Well, Choose Pharmacy programme aligns to the Welsh Government strategies of prudent healthcare, the Once for Wales, All Wales programmes, and a healthier Wales. The success of this programme is in no small part due to the excellent teamwork and leadership across key stakeholders and strong user engagement with a predictable revenue stream. I'm now going to hand over to Cheryl, Effie and Gareth and thank them in advance for this presentation, which will highlight some of the benefits of the investment that have been realised and some of the recognition that the team have had within Wales and beyond. So thank you very much, Cheryl.
Thank you, Iridian. Can you see me now? Right. I'm Cheryl Way. I'm Pharmacy and Medicines Management Lead for Digital Health and Care Wales. And with me today I have my colleagues, Dr. Effie Mansurani, who's our Research and Evaluation Lead and is also a reader in the School of Pharmacy and Pharmaceutical Sciences at Cardiff University, and Gareth Hughes, who is the Superintendent Pharmacist at Shepherd's Pharmacy Group in South Wales. I'll do a short presentation and Gareth will say a few words about using Choose Pharmacy as a community pharmacist and independent prescriber. Then we'd be very happy to take your questions. Can I have the next slide, please? Yes, thank you. So you may well have heard of Choose Well. This was a NHS Wales campaign that started in 2011, which aims to increase awareness of the range of services available to patients with minor illnesses or injury. And the Choose Pharmacy platform was developed by the former NHS Wales Informatics Service, now Digital Health and Care Wales, as part of the Choose Well campaign, but in response to a Welsh Government project following on from a programme for government commitment to implement a common ailment service in Choose Pharmacy in community pharmacies in Wales. We developed the platform called Choose Pharmacy that service sits on, and it went live in 32 pharmacies in Cwm Taf and Betsy Cadwallader health boards in October 2013. Further developments were taken forward by Digital Health and Care Wales with funding awarded from the Welsh Government Health Technology and Telehealth Fund and the Efficiency Through Technology Fund from 2014 to 2020, in line with new services that were commissioned by the Welsh Government under the Community Pharmacy Contractual Framework. And the timeline on this slide shows when each service went live on the Choose Pharmacy platform. We were also successful in obtaining funding to roll out the platform to the majority of pharmacies in Wales by March 2020. Could I have the next slide, please? So we felt it was important to integrate Choose Pharmacy with other health information systems used across Wales, and by doing this, we were able to provide access to the patient's Welsh GP record so that we were able to provide emergency medicine supplies when that service was introduced. We can also provide access to medicines information on discharge from hospital so that pharmacists can do a review and reconciliation of their medication with their GP record. We can send consultation summaries to GPs currently for the common ailments and flu vaccination service. And we can make any discharge medicines reviews done in community pharmacies available to view in hospitals through the Welsh Clinical Portal. We're continuing to integrate information and we'll be sending emergency medicine supply and independent prescribers e-summaries to GPs later on in 2021-22. And have the next slide, please. So just a few statistics for you. The services offered within Choose Pharmacy are now well established, and this slide shows the uptake of services to date. And you'll note that over 250,000 common ailment service consultations have been completed since it launched in September 2013, and well over 100,000 items of medication have been supplied since April 2016 through the Emergency Medicine Supply Service. There's some other stats there for you to look at if you're interested. Can I have the next slide, please? So this slide shows how the provision of one service, the seasonal flu vaccination service, has grown since it was added to Choose Pharmacy in 2016-17, when only 536 vaccinations were recorded, to over 92,500 in the previous 2021 flu season, with over 45,000 flu vaccinations being given in pharmacies last October. Have the next slide, please. So we asked patients what they would do if these services weren't available, and this data shows the year's information on the Common Ailment Service. So, for example, over the last year, almost 75% of people who use the service, that's almost 57,000 consultations, would have made an appointment with a GP. So that's equivalent to 188,000 GP appointments being freed up since the service launched in 2013. And we believe this provides evidence that having this service available reduces pressure on other NHS services. Have the next slide, please. So there has been considerable interest in Choose Pharmacy from other UK nations. We've hosted visits from leaders in both England and Northern Ireland to showcase the platform and the services it delivers. And we've even had a request from Northern Ireland to provide it for their pharmacies. So I'm now going to move on and give you an example of how we work by focusing on one module, the sore throat test and treat module. So could I have the next slide, please? So why did we go for sore throat test and treat? Well, it followed on from a review of the common ailment services, of which there are 27 ailments that can be treated. And we found that uptake of sore throat treatment was low, which we thought was unusual given the common prevalence of sore throat. So when we looked into it, we discovered that as pharmacists were limited to providing symptomatic treatment, so pain relief, under the previous service, they often had to refer patients on to GPs. The local GPs thought the pharmacists could manage many of these, and Cwmtaf Health Board approached us to deliver a service through pharmacies. So working with Health, Education and Improvement Wales to provide training, and the health boards to provide equipment, point of care tests and antibiotics in line with NICE guidance, we developed a module to support the service. There was a staged implementation from November 2018 in 56 pilot sites in Cwmtaf, Morgannwg and Betsy Cadwaladr University Health Boards, which were commissioned by those health boards. In line with the introduction, we also conducted evaluation led by Effie, and the aims and the benefits of the service are also shown on this slide. Have the next slide, please. So this shows the number of sore throat consultations carried out over the first 10 months of the service and the number of antibiotic supplies made. These were given in around 20% of cases, following a clinical scoring and a throat swab test for bacterial infection taken only if the score was high. And this compares with an average of 60% of sore throat consultations receiving antibiotic prescriptions in general practice, where point of care tests are not routinely done. Patients were reassured if the throat swab was negative, showing that they didn't have bacterial infections, so antibiotics weren't indicated. And pharmacists referred patients to other services where appropriate. The figure of 170 cases there relates to the first 5 months of the service, where we actually did 1,725 consultations rather than the 10 months depicted in the slide. We believe this service promotes antibiotic stewardship, thereby reducing antibiotic resistance as well as increasing patients' access to services. So, can I have the next slide, please? So we did give satisfaction surveys to patients who received the service, and as you can see from the questionnaire responses summarised here, that the patients who received the service, there was very high satisfaction, with over 90% strongly agreeing that they were satisfied with the various aspects of the service, as shown in the slide. So could I have the next slide, please? So what have we learned from the Choose Pharmacy project? It's been really important that we've worked with other people, all of our stakeholders, particularly the Welsh Government, Community Pharmacy Wales, health boards, and for sore throat test and treat, we also worked closely with Public Health Wales, the National Point of Care Testing Group, and Cardiff University for the evaluation, but there have been many others. We found piloting an early evaluation of each module allowed us to develop Choose Pharmacy to meet users' need, often what they felt was needed, and then what we developed didn't exactly meet what they wanted, and we were able to optimise the service afterwards. We wouldn't have been able to develop this at all without the dedicated funding we received through the Welsh Government Technology Funds. And our clinical reference group with user input, which included clinicians such as community pharmacies who use the service, were really important in designing what we did. And we're lucky that we have a strong project team and technical and clinical support for this, along with a really supportive project board with input from Chief Pharmacist and Welsh Government Chief Pharmaceutical Officer. Could I have the next slide, please? These are just some quotes from patient surveys, and I won't read them all out, but just one. The service was quick, professional, good to know it's available as GP appointments are hard to get. And if I could have the next slide, please. There's a few quotes from some of our pharmacist users, along with a picture of one of them. So that's a brief summary of what Digital Health and Care Wales has developed to support community pharmacists to provide additional NHS services to patients. The work we've done has been recognised, resulted in us winning 3 awards to date. And as all the team can't be here today, there's a few photos in the next slide, if I could have that, please. So thank you for listening. I'm going to hand over now to Gareth, who's going to give you some user experience of Choose Pharmacy.
Thanks, Cheryl. Good morning, everyone. So yeah, as Cheryl said, I'm a superintendent pharmacist at Shepherd's Pharmacy, but I was sort of fortunate to be involved as a user with Choose Pharmacy since its start in 2013 as a branch manager in the Cynon Valley. When we launched the Common Ailment Service, all the way up to being one of the Pathfinder sites for the Independent Prescriber Service, which we launched in June 2020 in Cwmtaf Health Board. So for me, as a pharmacist, it's been sort of transformational for, just releasing the clinical capability of what we can do in community pharmacy, as well as sort of decreasing workload pressure on GP services and other healthcare sectors, and most importantly, sort of keeping patients well at home, which is why we're all here. And the other big thing really has been access to patient records. So in a few of those services, for instance, the discharge medicine service, we now have access to electronic discharge records, which makes sort of reconciliation a lot easier. Previously, it was either the sort of 4th carbon copy from hospital or sort of patient history. And then we actually have access to part of the Welsh GP record for some modules as well. So for the emergency medicine service, we can see with the patient's consent their current list of medicine. So if they are asking for a supply, we can see what's acute, what's repeat, and what's discontinued. We have the on common ailments and emergency contraception, because it's an all Wales service, if a patient's access the service in another pharmacy, we can see that as well. So it sort of stops the sort of multiple presentations at different pharmacies. And then for the independent prescribing service, we have a larger access to the Welsh GP records, so things like blood tests. So for me, I do urinary tract infections and ear, nose and throat, so things like access to kidney function tests. Makes the job a lot easier and a lot safer for the patient, because before we'd be prescribing a bit blind. So it's really helped make our services safer and really release what we are capable of doing as well then. So I'm really pleased with the developments, and there's a lot more in the pipeline, I think, for what we can do for the future. Thank you.
Thank you. So we'd be very happy to take any questions that anyone has.
Okay. A question from Marion.
Thank you, Chair. Diolch yn fawr. Bore da bawb. Good morning, everybody. Thank you for that presentation. Really heartening to hear of this development, and I've seen it firsthand here in North Wales, how effective that initial pilot was and how very welcome it was. It's interesting to see the incremental growth that's happened over the past few years. And I guess my question would be, how can we maximise the potential of this service? How can we do more to raise awareness and educate the public of the potential of this service? The sore throat test and treat service has obviously been very welcome, but there's a great potential, isn't there, for far more people to take it up. And I just wondered what plans are in the pipeline in terms of raising awareness of this excellent service.
Cheryl.
So we've always worked closely with our primary care team within Digital Health and Care Wales, and they routinely visit GP practices and community pharmacies to raise awareness and to support people. We also work with Welsh Government around, promotion of this, and you may have seen sort of little infographics on Twitter over the winter. So the comms team within Welsh Government have always worked with us. We do try everything we can to get this out there, and we also work closely with Community Pharmacy Wales with trying to make sure that there's always pharmacists available within the pharmacies that can provide all the services, and that we have locums and people like that, given NADEX accounts so that they can actually access the service wherever they're working. And we work with IGDC to provide training for them. I think we could actually do with a refresh of some of the campaign literature, but Welsh Government own the copyright on that, so we have to work closely with them, and we have been doing that. I think that's probably where we need to focus our efforts going forward.
Thank you. I've got a question. Bwrdd, did you want to come in on that as well before I move on to the next question?
Yes, it is a point well worth making. I mean, the marketing element, both the signposting in our acute hospitals, so the A&Es and GP surgeries. We've had, it's worth noting, we've had very good and clear ministerial direction and support in the public arena, visiting of community pharmacists, using the service and highlighting the benefits of signposting patients to appropriate services to get appropriate treatment. And we continue to work with our key stakeholders on directory of services. Thanks, Bob.
Thanks, William. I've got a number of questions lining up. I think Helen Thomas next.
Thank you, Bob. I am live, sorry. I was waiting for the signal then, apologies. Thank you for that. That was a great run through of a great service and a great initiative, and shows kind of demonstrates the collaboration actually and what can be achieved. My question's for Gareth actually. So as a jobbing pharmacist out there, you kind of tantalised with, and there's more that we will and can do. Where do you think the priorities are for the application then, and where do you think it could best deliver greater benefit now in new services?
I think at the moment it's about expanding the independent prescriber service, and that's the goal. So we had the Pathfinder services last year, and it's about expanding on that. So we have probably the first cohorts in 2018 really for community pharmacy. So there's Welsh Government is putting more funding in for more places for independent prescribers, so it's sort of building on that service. And for us in Cwmtaf Health Board, for instance, we are trying to get a service which is common across the health board, so all practices and patients know if you have a urinary tract infection, if you have ENT condition, we're looking to build on skin and things in the future that you can go to the pharmacy. So I think that's our main one, as well as sort of continuing to build on our other services. And the other aspects then is how we can have our other parts of our teams involved. So we're looking at whether we can have our pharmacy technicians involved in part of the discharge service, or again releasing some of that capacity for pharmacists to do things only pharmacists can do, but also delivering the other services then.
That's great, thank you.
Thank you, Helen. Thank you, Gareth. I think I'm going to Grace next, and then I've got Rowan as well. But if I can go to Grace next, please. Hi, Grace.
Hi, thank you, Chair. Thank you. So fantastic presentation. Really appreciating the updates on this. And what I noticed in a lot of what you described was the collaboration with the citizen around getting what they need and the best place to choose that and where to go for that. And, you know, I know that in medicine, it could easily be said we have a lot of work left to do in our collaboration. And, you know, I'm wondering how can we develop aspects of Choose Pharmacy that inform and engage citizens? Because, for example, what I noticed in the sore throat test and treat, it wasn't simply not GP, you're here now, but instead was actually there was a test, people were able to see and understand, they had that information, they had the results, they were engaged in part of the process, it wasn't top down, and they were able to, you know, really get a visceral sense of what was happening and how that was working for them. And I'm just wondering if you have any thoughts on how we can you know, develop those engagement aspects of it. Thank you.
Thank you, Grace. Cheryl?
Yeah, well, I think maybe we should work more through our community health councils. It's, you know, I know they've been going through a refresh recently, haven't they? And we haven't been able to engage with them as fully. And obviously there are patient groups around that through Joe, our sort of patient lead, we might be able to access and find out what they're actually wanting us to do. The services that we deliver through Choose Pharmacy are ones that are commissioned by Welsh Government, you know, in sort of coordination with the health board. So we have to have a sort of funding stream for the services alongside the sort of understanding what the patients want. But we are getting suggestions, like Gareth mentioned, the urinary tract infection work that they're planning to pilot in Cwmtaf. And within the health boards, you know, they have some latitude to commission what they like within those services, but we tend to actually support services that are going to be provided nationally. So there's quite a lot of engagement with quite a lot of stakeholders that you need to actually get to the point where you can actually fund, train and deliver a service across Wales. But we'll certainly look more to involving patients within, you know, putting together the sort of plans for service delivery. Thank you for raising that.
Thank you, Grace. It's a really important point. Rowan, can I ask you for your question, please?
Thank you, Bob. And firstly, can I thank the team for you know, an overview of what I think is a really critical service and capability for everyone in Wales. I wanted to kind of reflect upon, you know, our community pharmacists in particular. They are on the high street, you know, they are very accessible, and as particularly patients collecting repeat prescriptions, you are probably the point of care that those patients see throughout the management of their own conditions. So with that in mind, you know, I'm really interested to hear from Gareth and Cheryl and Effie as well, from a research perspective. What are the other opportunities to deliver those monitoring services that might relieve some of the pressures on our very busy GPs, albeit that, to Cheryl's point, we still need to negotiate funding for it?
Do you want to go first, Gareth?
Yeah, thanks, Cheryl. And yeah, I think it's an excellent point, Rowan. I think there's lots of opportunity for community pharmacy, because you're right, we are the sort of regular point of contact. I suppose there's lots. I mean, there's different pilots in different health boards and clusters at the moment. There's things like sort of blood pressure, the monitoring patients. There's some do INR. even just sort of health checks, looking for atrial fibrillation and diagnose atrial fibrillation. So there's we've recently had primary community pharmacists, primary care cluster leads as well, sitting on every cluster, and that's something Community Pharmacy Wales are looking at doing, is collating all the little projects that have gone on in all the sort of 60+ clusters in Wales, and then seeing if we can have a sort of database of these services to see what we can roll out in the future. But yeah, I think you're totally right. There's a lot of scope, as you said, with the funding and the capacity, definitely.
Yeah.
I don't know, Effie, did you want to come in?
Thank you. I think that's a really important question you said there. So for the monitoring, from a research perspective, I'm quite cognizant, I suppose, that we have all these little pilots, but for prudent healthcare, we really need to know what's working and what's not working. And one of the reasons that the sore throat test and treat has been so successful is because there was a dedicated evaluation strand before the service was introduced. So when we rolled it out, we were able to work with the community pharmacists from day one to say, please, can you distribute the service in this way? And we were working with Public Health Wales to say, what do you need monitoring? And I think that's really important because there are too many pilots. So we do need to know what to take at a national level. From a Digital Health and Care Wales, where we can support this, is data linkage. At the moment, we are at a very embryonic stage of the pharmacy data being linked to any other data in Wales. And we're working on it hard, and Gareth John's team is really working on it. So the Choose Pharmacy data is now in the NDR. But unless we link that to all the other data and we can follow the patient journey, I think everything else is monitoring surrogate markers, which is great. It's great, don't get me wrong, but it's not the real thing. So it's capacity, funding and data linkage from my point of view.
Brilliant, thank you, Effie. Rowan, did you want to comment back on that at all, or are you happy with?
I would just say those were very full answers, and Effie, to your point about too many pilots, it is a bit of a kind of something you see across the NHS outside of Wales as well. And I think, you know, your point about measuring being embedded in the pilot is really critical. And I wanted just to say I heard that very clearly. So thank you for that.
That's excellent, thank you. Oh, I've got one more question, I think. Sean, you take one last question on this, and then I'll draw this to a conclusion. Ridin, I'll probably come back to you just in case there's anything you want to add at the end. But Sean?
Yeah, it was a very quick question. Being in the front line and being so close to patients, how much has COVID changed some of the agenda, or perhaps reprioritised for you guys in terms of what we've learned, but also how it could impact all these pilots and some of the work plans going forward?
Well, Gareth is the most front line of us, I think, so it might be best that he answers that.
Yeah, thanks, Cheryl. Yeah, I mean, the one benefit we have had with the services is a bit more flexibility now. So previously, all consultations had to be in the pharmacy, in the consultation room. So we have had more access now to remote consultations, both telephone and video, which I think actually long term will open up the service to more patients. So if people can't come to the pharmacy for work or health reasons, they just wouldn't be able to access the service. So I think that's actually been good. I think when initially, obviously, with the workload pressures of dispensing, it was hard to keep on top of those services. But I think afterwards, now as we build to the future, opening up that field for everyone to access pharmacy services will be a positive for sure.
Excellent. And I suppose just making sure that citizens of Wales understand that that is available as a service will be critical as well. You know, thank you.
Thank you, Sian, and thank you, colleagues, for the responses. Ridian, just come back to you before I close the item. I don't know if there's anything you want to add.
Well, I'd just like to take the opportunity, Bob, to thank the presenters and to do a little bit of marketing and point the public to the Choose Well website that provide further information of services that are available in your locality.
Brilliant. Thank you, Ridian. And can I just add my thanks to Cheryl, Gareth and Effie for joining us today. This was a little pilot, I suppose, in its own way, in terms of the first time we've done this with the board. And I think very successfully, certainly from my point of view. I got a lot from that presentation, you know, an understanding of the sort of system impact that this initiative has had, but also to get direct feedback from patients within there as well, and from professionals, and the research angle has added some greater depth to that as well. So I'm immensely grateful for you for joining us this morning and sharing your story as a first for the board. And I think it will certainly encourage me that we need to sort of look for more of these in all of our future board meetings. So I don't think I've got any other questions from anybody else, so I will close that item there. And a chairman's delight, we're pretty bang on time, which is great as well. So thank you for that in terms of the quality of your presentation and so on. So thanks again.
Thank you.
Thanks so much. Take care.
Thank you, everyone.
Okay.
Bye.
Good. Well, again, thank you everybody for that, and for the team, Ridian and colleagues who highlighted this particular example to share with the board, and for the work that's gone in behind the scenes to get the item here today. As much appreciated. Thank you. If I can move us on now in terms of the agenda. So the next formal item on the agenda is my own update report for this month. And there's a few things I just wanted to highlight through that. The first is to say that as part of our developing approach to stakeholder engagement, one of the things that we're now trying to do as a board is set up initial conversations with each of the other main health organisations, the health boards, the trusts, and HCIW as the other special health authority. Initially, this is because we're new in that sort of sense as a board. It's about getting to know one another. You know, we are only just under 4 months into our life as DHCW, but it's also, I think, very important for us as a board to really try and understand what's going on locally, what the issues are for health boards, and then in particular what we can do working in partnership with colleagues in health boards and trusts and so on, in order to sort of further the agenda. So this round of meetings is a first. It builds on a lot of other activity that's going on at the moment through Helen and her team, and all of the other networks that board members of Digital Health and Care Wales are beginning to engage in. And my report just highlights the fact that we had the first of those meetings on the 14th of July with CUMTAF, CUMTAF Morgannwg University Health Board, but subsequently since then, actually since the report was written, we've also now had a very good first meeting with Halvar Health Board. And Ruth Glazab, my vice chair, and myself also yesterday had an initial conversation with the chair and vice chair of Valindra Trust in terms of preparation for a joint board meeting that we will have probably in September. But they're all in the diary now, and it marks, as I say, I think, an important step for us in beginning to develop our relationships across the system. My report also highlights that since our last meeting, we've had a couple of important things have happened nationally in terms of the publication of the programme for government for the period 21 to 2026 for the 6th Senedd. It's important, it's a document clearly in the public domain, but it sets a clear steer, I think, for the whole system in terms of what is required over this next period. And certainly from our point of view, it was pleasing to see the focus in the programme for government around the use of digital and new technologies. And that has been very much, I think, reinforced by subsequent meetings that Helen as chief executive, myself as chair, and also Ruth as our vice chair, with vice chairs and the minister, those ministerial meetings where the minister has spoken to the service and emphasised her priorities, as I say, for this next period. The Minister also at the Chair's meeting made a special mention, really, in terms of her thanks to all NHS staff for the work that they've done through the pandemic, and I would just like to echo that as well in terms of my comments this morning. In terms of the next item, the appointment of the substantive chair for Digital Health and Care Wales, you will know from previous meetings that my appointment as the interim chair was for a period of a maximum of a year. So my term of office will conclude by the end of October at the latest. The public appointments process is currently running for the appointment of a substantive chair. Shortlisting has taken place. Interviews will be being held, I think it's the 18th and 19th of August. So I'm hoping that it won't be too long before we know the outcome of that approach. And then we'll be able to think through the timing of the take up of the role, hopefully by a new chair, and for me to be able to help to manage that sort of transition from my interim role to the substantive chair. So progress is being made there, which is good. I mentioned in my introductory remarks, and I'd like just to reiterate that my welcome today to our associate board member from the trade unions, Andrew Fletcher. As I said, Andrew will take up post with us formally from the 1st of August, and that tenure is for a 12-month period in the first instance. It's an ex officio appointment to the board, but to all intents and purposes, Andrew will work with us as a board member through all of our business as we move forward, and I'm looking forward to him taking part in our discussions in due course. I also note in my report the board development session. We have board development sessions in the intervening months between our formal board meetings. The last of those was the beginning of July, and we went through quite a wide range of issues in that meeting, which are just highlighted in my report there around risk and board assurance. Quite a lot of work we're doing at the moment about developing our approach to risk. We'll come on to that as a specific agenda item later on the agenda. But also establishing our relationship with our external regulators in terms of Audit Wales and our internal auditors. We had an excellent presentation from Alan Warder, who is leading on the National Clinical Framework for Wales, and Alan joined us to engage in a discussion around that. And we will be key partners in taking that work forward. And we also had some wider discussions around the kind of wider NHS Wales governance framework and how we fit into that as a new SHA. And finally, we spent some time, and again, we've got an update report on the agenda today around the work that we're doing to develop our approach to stakeholder engagement. Final couple of things is to note that I also had an initial introductory meeting with James Quance, who's our head of internal audit. Really important that we've got excellent working relationships both with external audit and internal audit. So I was grateful for James's time to sort of talk through the approach that they're going to be taking, and to sort of get, as I say, to begin to build that relationship. And then finally, just to note that our vice chair, Ruth Glazard, has been appointed as an interim board member for the Centre for Digital Public Services in Wales. There's a lot of synergy between the work that we do and CDPS, and I think we've established an initially strong working relationship with them, but it's really a great advantage that we can get some cross membership of some of the boards who are working in the kind of digital space in Wales. And I will also note in my report that we also have another of our board members who is also a board member of another of our key partners, and that's Grace Quantock, who's our vice chair of Audit and Assurance Committee, but Grace is also an existing board member of Social Care Wales, who, as I say, are one of our key partners and increasingly will be so as we move forward as an organisation. So that's just a brief run through some of the key issues for me over the last month in my report. The board is just being asked to note that report. I don't know if there's any comments or questions on anything that I've said. So I'll pause for a moment just to see if there is, and if not, I will then move us on to the next item on the agenda, which is over to Helen for her Chief Executive's report. Okay, so I'm not seeing any questions. So Helen, I will hand over to you.
Thank you, Bob. Bwrdd, everyone. Good morning. So just a brief update from me this morning. So to start off, we had the Special Health Authority Programme Board meeting this month on the 8th of July, where we received, the Programme Board received the programme closure report, recognising that we have indeed successfully established as Digital Health and Care Wales on the 1st of April. So we've got one further meeting scheduled now for October. We recognising actually lots of synergies, as you'd expect with the Chair's report, recognising the close collaboration and engagement work that as a national organisation within this sector that we need to undertake. We've got a number of memorandums of understanding with key partners and stakeholders in development at the moment. So there's one with the NHS Digital. We have a close working relationship with NHS Digital, and we are setting out our roles and responsibilities around the exchange of data between the organisation. So that's being drafted currently, and we'll come to the board shortly for sign off, just to keep you cited on that. Similarly, with Social Care Wales, we've been doing a lot of close working with colleagues in Social Care Wales, and we're building really strong relationships, and it's really positive working with them on the agenda, and much of it, as you'd expect, is a joint and shared agenda across the health and social care sector. So we are developing the memorandum of understanding, and that will kind of clarify the roles and responsibilities again, particularly some key aspects of the work under the National Data Resource Programme, where there's been very close joint working in the development of the data strategy work for social care, and how we will then develop the joint working going forward. So again, that one will shortly come to the board for approval, but just to update you that that's happening. And in terms of our relationship with the NHS Wales Collaborative, we work very closely with the NHS Wales Collaborative on a number of key national initiatives. So we've been working on setting out the roles and responsibilities of the both us and the NHS Collab in terms of taking forward and supporting national digital initiatives. So lots of good joint working going forward in terms of clarifying where programmes and projects would sit and where the roles are in terms of providing the key expertise from both of us and both of our teams into those. So we discussed this with the NHS Collaborative and their executive group this month, and we've set out a way of working to take that forward. In terms of strategic engagement, as Bob said, in addition to the board-to-board meetings, we've been having a number of strategic engagement sessions, exec team to exec team, with majority of organisations. We've had one, if not two, and we may be on to subsequent rounds now. And the purpose of the sessions, I mean, they've been really great actually, to whilst virtual, at least getting round the table and being able to actually have those discussions virtually, face to face, to understand both the strategic priorities of both of the organisations that we are speaking to. So the intent of those discussions is to keep kind of having those strategic conversations, to keep understanding and appreciating the shared strategic objectives that we've got in terms of delivery of a healthier Wales, but also to develop a joint plan between the local delivery organisations and Digital Health and Care Wales. So they're progressing really well. And of course, we'll have the wider strategic engagement on the agenda later. In terms of COVID response, just to keep you updated, you'll be aware that we've been providing the digital support for Test, Trace and Protect programmes and the vaccine programme for NHS Wales, well, for Wales. So further priority work that's happened during this period. So you'll have seen some of this actually in the media. So the COVID pass, so we supported the availability of the printable COVID pass, and that was quickly followed then by the availability of the digital certificate around your COVID status. We're currently working on developments for the vaccine booster programme, and we're exploring the options for supporting digital facing booking for the vaccine booster programme. Moving on to the joint executive team meeting, we had our first one of these with Andrew Goodall, Chief Executive of the NHS, and his executive team earlier this month. And the purpose of those meetings is to have a formal review of the year gone by and a look forward into this year and where we're heading in terms of our plan, and to be able to share all of that and with Welsh Government. So really positive feedback, really positive session, actually quite helpful in terms of reflecting back on the previous year and identifying some of the key areas that we need to focus on and will need support on from Welsh Government, and where they would need support from us. So very, very positive feedback and positive session, and particular thank you from Andrew Goodall and his team to the organisation for the support and developments and the response that we as an organisation have supported to the pandemic. So just worth on record recognising the gratitude that was received from Welsh Government colleagues to the wider organisation. In terms of the data centre transfer, the plan is on track. We will be exiting one of our data centres at the end of October, so all on track for delivering that. In terms of the top level structure, I'll come to that in the next agenda item. There's a paper for me to walk you through. Annual plan feedback, we've noted that on the agenda, so all of that is has moved on. And then just to finish, as Bob mentioned, I too have had a meeting with the Minister earlier this month, and where we discussed priorities for the new organisation, and really the key messages from the Minister are to build on that positive response that we saw from the pandemic, and really highlighting two of the main priorities for the Minister and this government turn being actually the digital offer for our patients, and how we will communicate and support patients in their health and well-being, and e-prescribing. Both of those were identified as key priorities, and further meetings will be arranged now in due course. But that was the update for me. Thank you, Chair.
Thank you, Helen. A very full report, and clearly, I think, you know, when Helen's reflecting back in her report, it's really about the work of the whole team, Helen, isn't it, in terms of everything else that's going on, around you. But a very full period in terms of the work and activity. I think I've got one question, Helen, from Rowan. So can we go to Rowan just to pick up a question on Helen's report?
It was a comment actually, Helen, and just to build on the thanks that you've been getting for the COVID response, and just to recognise the wider recognition that is really resulting from the team's phenomenal response to COVID. I picked up something in the Financial Times a few days ago, a report published by the Cardiff University Welsh Government Centre, where the monies allocated from Westminster under the Barnett formula, because of the public sector approach that the Welsh Government took, not only have you been instrumental in delivering a fantastic enablement of a COVID service in Wales, the government has spent 48% less in doing that per person than in England. So in Wales, £158 per person has been spent, and that's meant that the Welsh Government has been able to redeploy the savings into supporting small businesses in Wales through the pandemic, which they estimate has saved 160,000 jobs. So I wanted to thank you, and also hope that you will share that, if it's not already widely known within the service, that the impact has been felt in Wales in many different ways. So thank you for that, Helen.
Thank you, Rowan. Appreciate that, and you're right. That brings it into focus, doesn't it? And I think what was genuinely, having been very much personally a part of the many of the meetings and the teams and the planning sessions. Actually, it was definitely a Team Wales effort right across all public services. So yeah, it's great that analysis is there to highlight that. Thank you, Rowan.
Thank you, Helen, and yes, thank you, Rowan, for making that connection. And as Helen said, you know, it's been very much a whole team response, hasn't it, from government and right the way across the country in terms of everything that's been done and continues to be done. Okay, I haven't got any more questions in relation to Helen's item. We're bang on time, so we have got a short 10-minute comfort break scheduled, which we'll take, and I'll see you back at 11:10. Thank you. Okay, I'm hoping I'm live. Can colleagues hear me?
Yes.
Yes, we're good to go. Excellent, thank you. Okay, let's get back to the next parts of our agenda, part 5. So we move on to some of the major strategic items for the day. For the first of those, I'm going to again hand back to Helen, who's going to talk the board through the executive structure proposal. And in terms of the paper that's here today, we're being asked as a board to approve the outline approach as set out in the paper by Helen. So Helen, without further ado, I'll hand over to you.
Thank you, Bob. As the paper sets out, this is to provide the board with the proposed executive structure for the organisation and to set out the timeline for the process that we will take forward under the NHS Wales organisational change policy. You'll note that the establishment order for DHCW sets out that we will have 5 executive officer roles, and 3 of those were specified within the establishment order, and that will be myself as Chief Executive, Claire Osmondson-Little as the Director of Finance, and Rydian Hurl as the Executive Medical Director. So those 3 appointments have been made. So we now have the 2 remaining executive director roles to appoint to. So in terms of the structure and appreciating the role and purpose and functions that we are discharged to deliver, the proposed structure set out in the paper focuses on 2 executive roles, as we've said. So the first being a Director of Digital Delivery, that is taking forward the operational services, leading on the operational services for the organisation. The second being a Director of Strategy, to really do the forward-looking horizon scanning and setting out the strategic vision and direction for the organisation, as well as taking forward kind of our core planning and performance functions. But we've also set out, I've also set out the requirement for 2 additional director roles. So they will be directors around the board table as the proposal, but not as an executive, therefore not with a vote around the board table. But the reason for that is I feel that we need to have a major focus on the primary and community care integration agenda and really be clear about what the strategic digital offer is for this in this space, and align that with the great amount of transformation work that's going on in terms of out of hospital care integration across primary and community care. And the second being us needing to have that huge focus on our workforce and our biggest asset being the people that work for the organisation, and how we support that agenda, how we develop our existing staff, how we ensure that we have the pipeline of talent in the digital professional disciplines that we need in order to grow and expand and be successful, but also to provide that leadership role across the NHS in Wales in terms of the professional development agenda for the wider digital workforce in health and care. So in terms of the paper, I think that the focus on delivery and therefore on strategy actually speaks to some of the challenges or criticisms that perhaps the predecessor organisation had in terms of ensuring that we had a focus on operational services and stability and provision of and availability of our systems and services in the Director of Delivery. And then in terms of strategy, actually making sure that we have a clear strategic focus at all of the layers that we need that across all of the systems and services, so both as an organisation and how that meets the ambition set for us in a healthier Wales and what will be the refreshed digital strategy from Welsh Government, but also how that layers through our systems and services throughout the organisation, so that we have those strategies for our products and all of the roadmaps available in terms of where we're heading for all of the systems and services that we are developing and delivering. In terms of timeline then and process. So we are undertaking the process, as I said, in conjunction or under the procedure outlined in the All Wales Organisational Change Policy. And I guess it's worth noting that there are a number of steps for us to go through, and we will be moving forward also to external recruitment processes as part of the appointment to these roles. So that is likely to take us some time to get people into post, but we will be moving through the plan as swiftly as is possible. The other thing to note is that we have issued the proposed structure under consultation with the senior leadership team in DHCW. And we've also shared it. I shared it as part of the staff briefing to the wider organisation on Monday, and I have urged our staff to and encouraged them to talk about it within their teams and to actually provide their feedback so that we can assimilate that and to take on board where we feel we need to make some changes based on feedback received, and that we will then I will bring that to colleagues around the table once we've worked that through. So really it's for the board to discuss. I'm happy to take any questions on it and really to approve the approach that's been outlined. But I'd also like to, before I hand over for questions, just take the opportunity to thank the leadership team that we have in Digital Health and Care Wales for the leadership and the support and commitment that they are continuing to show to the organisation as we develop and deliver as a new organisation. So I would just like to put that on record in terms of my great appreciation and gratitude for the support we've had.
Thank you, Helen. I mean, board colleagues, obviously we've had a chance to discuss these proposals as they've been developing, but it is an opportunity if there are any other comments or questions anybody wants to raise on anything that Helen has said. I think, obviously the important thing is to recognise that in approving the approach today, it is one which puts us into a consultation period. So we have to reflect on the fact that depending on what the outcome of that consultation is, the detailed proposals may change, Helen, according to the feedback we get and the further consideration we'll need to give to that as a board. And I would just add, I think, this is really one of the critical objectives for the organisation over the next couple of months to complete the process of the establishment of the full board. Obviously, we've got a full establishment of independent members. I talked earlier about the timetable around the substantive chair, but at the moment we've got 3 of the 5 executives in place. We need to get the other 2 sorted, and those additional posts that Helen has highlighted I think are critically important. I'll just add, Helen, actually, because you talked about the Director of Primary Community, mental health as well. I think it was an important part of that, isn't it, in terms of that particular remit, which I think reflects, as you say, the wider agenda. But I don't know, colleagues, if there's anything further anybody wants to add, any queries, clarifications, or if not, I'm going to take it that we are content to approve the paper and the approach that's outlined in the paper. Okay, I'm taking silence as assent because I can't see your faces and body language and so on. So, Helen, you can move this on now to the next stage, and I look forward to discussing this further and progressing this with all speed.
Thank you, Bob. Appreciate that. Thank you, colleague.
Okay, if I can move us on then and hand over now to Michelle, who's going to take us through the next item on the agenda, which is an update report on the work that's ongoing about the development of our stakeholder engagement strategy. And again, this is a report that we're being asked to note today. So, Michelle, can I hand over to you? Are you live? I think you're live.
Am I live? Thank you, Chair. Yeah, good. Thank you. So as Bob said, I'm bringing a bit of an update really on where we've got to with the stakeholder engagement strategy and plan. for the board today. In the paper, I just wanted to call out by way of introduction. Obviously, we recognise this as a key priority as a new organisation to develop a strategy in terms of how we wanted to engage with our stakeholders, who our stakeholders were really, and who the key people were that we needed to ensure that we were really engaging actively with. And to develop the plan in terms of how we would take that forward. So we actually appointed a company called the Consultation Institute to work with us on this. They've got extensive experience in terms of engagement and consultation, working with a whole range of organisations really, and they've also done work with other organisations within Wales, which we thought was helpful experience from our perspective. So just to be clear about what we mean by that, because it is quite a wide-ranging topic, I think, and we're finding that more as we get into it, that what we've asked them to focus on really is our external facing stakeholder engagement. So just distinguishing that really from internal facing inside the organisation, which we will be also very focused on, and communications. Obviously, communications is a key aspect of our engagement, but in terms of a communication strategy, again, we would deal with that separately. So just to remind board members, I guess, what we've asked the Consultation Institute to do with us and what the board might expect to see as we move forward. So we're looking at how we articulate the vision and values of the new organisation. Then to understand who our stakeholders are, as I said, to do some stakeholder mapping really. I'm certainly of the understanding now that will be probably an ongoing process right the way through the life of the organisation. It's never really stationary. So this is a sort of starter for 10 really, as in terms of where we are now. From that, we will then develop the engagement strategy itself and the plan as to how we will take forward the strategy. So obviously really key for us. I had hoped, to be honest, to be able to bring the strategy to the board today. I think having spent a bit of time with the team and also in our discussions in the initial board development session where we had some opportunity to start this conversation really, that we felt it was worth investing a bit more time for the board to be engaged in this exercise, and also time for our stakeholders to really share their views with us so that we could take those on board in terms of how we move forward. So in terms of where we are now, there is good progress being made, quite a lot of activity in terms of moving that forward. So some key examples, we've issued a survey within our own organisation, which has been quite interesting in terms of how the folks who work with us feel about the organisation and its vision and its values, and how they want to help to shape that as we move forward. We've done a lot of work on the stakeholder mapping, and that's going through a validation process. The shift now, I guess, is toward engaging actively with different stakeholders, including one-to-ones with members of this board. So those are starting next week to get more board members' direct input to those conversations, to key stakeholders, and we've identified chief executives in the health boards and trusts and other key organisations to get some initial views in terms of their expectations of Digital Health and Care Wales. And then the plan is to broaden that really with some focus group type sessions so that we can get quite wide range of views to help us think about what the expectations are for our organisation and how we should respond to those and how we should shape our approach to working more widely. So then if the plan in the appendix hopefully clarifies, the intention is to bring all of that sort of feedback and input into a development session with the board in early September, with a view to bringing the strategy to the formal September board meeting. So I'm happy to take any questions from board members on progress or indeed next steps.
Thank you, Michelle, for the update. And as you say, I think this is it's a really important piece of work. It fits around a variety of different things that we're doing, I think, at this moment. But this next period for the board and for the new organisation really is very important, I think, as we begin to think less about establishment, which is where we've been over these first few months and getting up and running and so on, but moving on now to the next phase of our development and thinking about long-term strategy and how that might be different from the past. And as you say, how we do that in partnership with what is a really quite wide variety of stakeholders from different sectors and so on and so forth. And as you say, I'm hoping that we've got our board development session planned 2nd of September, I think it is, which we really want to try and get a stronger focus on the kind of the strategy element, independent members are doing some thinking of their own on that as well, which we're going to feed into that sort of process. But hopefully we can begin to bring some of these strands together in the time that we've got available in the early part of September and move that forward. I can see one question coming in from David, so I'll ask David if he can pick up his question or comment.
Thank you, Bob. Thanks, Michelle, for the update. Just one thought occurred to me, partly as a result of your presentation and also the one from Helen. The Director of Strategy post we're likely to recruit based on the plan that Helen's outlined, sort of January next year. But we're looking to make some decisions around the plan and the resources required in December, which doesn't really give the new Director of Strategy much of an input, and given that person's likely to be the person leading the charge of that. Is there some way we could maybe try and reconcile those two so we get some input from that new appointment prior to firming up on the plan?
Yes, I think that's a very good point, David. It's interesting timing, isn't it? And I think the challenge for us as ever is we are keen to move forward with engagement now. I mean, we are engaging, aren't we? We're all engaging, as has been noted in the board, but to have a systematic plan, we will be working on our IMTP, starting that quite soon, actually, because obviously the timescale for that. So perhaps it would be better to think toward an interim strategy or an interim direction that we could be comfortable with as a board, which would enable the new directors coming in to also then offer their views and to shape that into as we move forward. As I said, I think this is an iterative process anyway, but you're absolutely right to call that out. I think they would want to have a keen view on that, wouldn't they, as they come on board?
No, I would echo that, Michelle and David. The timing of these things when you're in this sort of early stage of establishing the new organisation, it never works perfectly, does it? So we've got to do what we can do. We can't delay things until a substantive appointment is made, because in effect we miss almost the sort of next planning cycle if we do that, and we can't do that. But I agree absolutely with Michelle about how we need to engage whoever is appointed into that role in due course. Sian, you wanted to come in. I'll hand over to Sian.
Yeah, diolch, Chair. Thank you. Michelle, a quick question. I really like the focus on external as a new organisation being critical to understand what our stakeholders would want. Included in the external facing work and the focus group will be patients and citizens be involved as well in that, in understanding their thoughts, especially after COVID as well, with a digital agenda. Thank you. Yes, absolutely. Another really key point. Thank you, Sian. Yes, and we were having that discussion yesterday in a planning discussion about how we can effectively engage the right, kind of stakeholders and get a really broad range of views on board. So yes, in terms of the kind of organisation we are, you would absolutely expect us to be thinking about the ultimate recipients of care. So yes, we will make sure that that's included. Thank you, Sian. Good. I thought you would have thought of that. Thank you.
No, thank you, Sian. It's an important reminder, but it does cut, I think, to one of the key things about how we want to be as Digital Health and Care Wales, doesn't it? In terms of open, engaging, working with communities, working with patients, working with professionals, working with all of our stakeholders. It will take us some time to build up our mechanisms for doing that. But it's an absolute commitment, I think, for the new organisation that we operate in that way and are very, very focused on the people who use our systems and services, and ultimately as Michelle says, the end point of all this is around improving health outcomes for people and improving people's experience of services and so on. Okay, I don't think I've got any other questions coming in, Michelle, in relation to the update on that. So thank you for that. I appreciate the amount of work that's going on behind the scenes and the way that you are engaging people outside the organisation, but also internally to the organisation. And I'm really looking forward to us trying to pull these threads together early part of September to try and sort of be clear then about the broad approach that we're going to take moving forward. So in terms of the formalities, we'll just as a board, I'm asking people to note your update report today. Okay, so thank you. Now you can't go away because you're next on the agenda as well, Michelle. in terms of the next item, which is the strategic procurement report, where we've got a couple of really important contract awards to confirm today. So again, Michelle, without further ado, I'll hand you over to that and you can just take us through that. And I think to be clear about the nature of the decision that our board is being asked to take today, because for other stakeholders and people who are engaged in this call today, it's in recognition that there's a whole process that sits behind these contracts, isn't it, in terms of the decisions about who to award and so on and so forth. And our role was quite specific in this. So Michelle, if I could just hand over you to take the board through where we're at.
Thank you, Chair. Yes, I'm going to try and walk through those key points because I think that is quite key in terms of understanding and roles, and also the number of parties we've involved in this, as Bob set out for us there. So I've put forward, there's a cover paper that sets out in summary for I'll just run through some of the key principles. So in accordance with our standing orders as Digital Health and Care Wales, any contracts that are anticipated to be over the total contract value of £750,000 are required to come to the board for the board's approval to execute the contracts. I think there's a slightly interesting nuance for us, particularly it feels as an organisation, because often in executing contracts we're actually doing it for a much wider stakeholder group. So for other stakeholders in NHS Wales, all Wales, or for a majority of users across Wales. And I'm going to talk about 3 such contracts that I would put into that bucket today. So not necessarily for the benefit of our organisation, but much wider. And because of that wider benefit, the governance here I think is key in terms of have we appropriately engaged the right stakeholders and the right decision makers in getting to the point where we're now presenting these contracts to the board. So I've got 3 contracts that I'm presenting, and they are presented for the board's approval today. I'm going to give a bit more detail on the first one, and then I will pause and give the opportunity for any questions or confirmation before I move into the other 2. See, the first contract that we've presented, and there is a little bit more detail in the associated paper, relates to the systems and services that we provide to general practices across NHS Wales. So Digital Health and Care Wales actually has a key role in the provision of IT services to our general practice colleagues. And in order to enable that support provision, we put in place a contractual arrangement. So the contractual arrangement in this place is the framework agreement, which means it's a non-committal agreement, if you like. It sets out the terms under which we would engage with suppliers. It's a multi-supplier agreement, and it's multi-supplier to fit with the requirements that the GPs have in terms of their contracts with Welsh Government, that they would have a choice of systems, and that's quite important. And that message has been reiterated to us by the GP community in Wales. So the governance around this one, I think there is a specific board that has been established to manage IT services. It's called the GMS IMT board. It is set out in the paper, but I thought it would be helpful just to run through quickly. So this is quite a significant board. It's got representatives from our health boards. So that tends to be around Director of Primary Care and Associate Medical Director, from the Royal College of GPs, from the General Practitioners Committee Wales, from practice managers from Welsh Government, and from Digital Health and Care Wales. So quite a wide group of stakeholders who are involved in that board. And the role of that board in this case would be to define the requirements, so the needs of the practices, to agree the approach to procurement, and also to agree the recommendation as to who should be appointed onto the framework. So we, as I said, we led as an organisation the procurement in accordance with our standing orders and standing financial instructions. But the decision very much sits with that board, and also the funding is provisioned specifically by Welsh Government for these services. So we've got ring fence funding from our perspective, which is sufficient to cover the contract that we're proposing to enter into. So just a little bit more about the agreement itself. As I said, it's a multi-supplier framework. We are proposing to award onto the framework 3 suppliers who met the criteria under the procurement. So EMIS and Segedim. People may also know those as Vision. Vision is now the name of the product. Both of those suppliers have a presence in Wales. And a new entrant to the framework who are proposing to add, which is the Phoenix Partnership, or otherwise known as TPP, who are also quite a significant GP system supplier in England, for example. So these are all proven suppliers in this market, and they've all demonstrated that they are able to meet our requirements to get onto the framework. They're all delivering services through a private cloud hosting type arrangement, and the term of the agreement and the term and the value, and I just wanted to explain that because that is there is some detail in there. So the term of the initial framework is 5 years, and then we have the option to extend up to a further 5 years. That's quite a long time. Again, that's non-committal, so it gives us the opportunity to extend should we wish to do so. And the key issue here is about stability of service for the GP practices. So that gives us flexibility. We're not obliged to do that. And also the way in which services are delivered through the framework, they're called off by the health boards on behalf of their practices. And a call off, which is actually the direct contractual arrangement, can be anywhere between 2 to 5 years. And we've got an extension option on that as well. So that's up to another 2 years. So if anyone's doing the maths there, and I have checked that honestly, that's potentially 2 lots of 7-year call-offs could be made under the framework if every practice called off to the maximum of the duration, which they were able to do so, which gives us the value that you can see in the paper. So that is the maximum value that we might expend. That's the 71.4 million that might be expended under this framework if we chose to execute agreements in that way. So just confirming the key points I'd raised earlier, I just wanted to note that the board, so the GMS IMT board, have approved the recommendation to appoint all 3 suppliers onto the framework. We also, as part of our standing orders, are required to notify Welsh Government that we're proposing to enter into a contract. So that's for us, that's any contract over £1 million. We've been through that process with Welsh Government. They have acknowledged our notification, which is our requirement as a statutory body, and I'm now presenting that to the DHCW board for their approval to execute the framework contract. I will pause there for questions.
Thank you, Michelle. Yeah, let's just pause there before we go on to the next 2 and take these in sequence. Clearly, strategically, a really important procurement process that we've been through, fundamental to the operation of primary care and the whole system in Wales. Rowan, I think, wants to come in with a question. So can I go to Rowan, please?
Hi, thank you, Bob, and good morning, Michelle. That was a fabulously clear and concise overview of a robust procurement process that you've run. And I would welcome this contract. I think it's really important that we offer our GPs this optionality, because the last thing that would be good for the health service is to, have a situation whereby GP surgeries would be being asked to change their systems during a pandemic. That would be incredibly disruptive. I read from the briefing that we've been asking people to provide the set of functionality that the GMS IMT board set out for a fixed cost, and not all of the suppliers have been able to offer everything under that for that fixed price. And of course, that's in their purview as commercial organisations. Nothing surprising there. But I think from my perspective, although that will have come up towards the end of the procurement cycle, we as the board of DHCW have to reflect on what that means in terms of supporting these installations going forward for what, as you point out, could be a long period. And I can foresee under these arrangements GPs having varied installations because of their needs and also because of their economic capacity. We know that GP surgeries, are not always fully economic, and I suspect that will give our organisation a greater burden of service in terms of costs there. So although I support the contract, I wonder if there's any opportunity to go back to GMS, IM&T and get some recognition for that potential additional service going forward.
Thank you, Rowan. So yeah, it's sense is highlighting sort of potential downstream risk, isn't it, to us as a consequence of that. Michelle, do you want to come back and respond?
Yeah, no, it's a very good point that Rowan calls out. Thank you, Rowan. And you're right, it's a competitive market. It's a relatively small market in Wales, to be honest. So we have somewhere around about 400 practices in Wales, but we are really keen to maintain that choice, as you say, and practices will have clear views about what works for them, which may be different to other practices for very legitimate reasons. So maintaining that choice is important, but suppliers need to deliver that in a manner that's viable for them, don't they? And just for clarity, the prices, we've gone with a fixed price model, if you like, for the core services. So all of the core GP services are in the fixed price because it's a fixed funding envelope. So that's the parameter that we have to work within. The issue then becomes, okay, there are some aspects of additional functionality, you're absolutely right, that come at additional cost. I think there are two things there. Obviously, the practices do exercise a choice, so they could choose that system, or they could choose perhaps another system that has further functionality in it within the core price. There have also been discussions with Welsh Government and the GMS IM&T board, as you suggest, in terms of how we might address any potential shortfall, if indeed there is a shortfall. And that's something that now needs to be worked forward, I think, as practices, and perhaps I wasn't clear enough about that, the actual picking whether it's which of those three systems it is made by the practice themselves. And practices may do that on a cluster basis, and increasingly we're seeing the benefit of clusters working together actually with a common solution in terms of moving forward, or they may do that on an individual basis, and again that's their choice. But as practices now, as we execute the agreement, practices will now then exercise that choice. I think we will start to see the implications of that choice, and we can then have the conversations about what does that mean in terms of the wider functionality.
Okay, thank you, Rowan. I think, as you said, it's an important point that you've raised, and we will. I think in my assumption that we move on to approve the award today, we will take note of that in terms of how we take those questions back into the wider process that sits beneath this, because you're absolutely right. We can't stumble into problems downstream if we can anticipate where some of those may emerge early on. I'm not seeing any other questions coming up from board colleagues at the moment. So, Michelle, I'm going to move us to, unless anybody wants to flag anything, I'm going to move us on to the to formally approve the award of the GP Systems contract today. And again, if I can thank you, your team and colleagues for the huge amount of work I know has gone into this to get the service in Wales to this point today. So thank you for that. And we will formally approve the award of the contract as set out in your paper, which moves us on to another strategic procurement, which is again really central to what we're trying to do as Digital Health and Care Wales in moving forward, which is around the application partner for digital services for patients and the public. So I guess this is one of those areas where we're hoping that downstream patients, the public, will start to feel the real impact of developments that are coming from digital services. So do you want to take us through this next one as well, please, the two contracts associated with this?
Thank you, Chair. Yes, as Bob said, this one's really quite exciting for us, I think, for a number of reasons. This marks a material opportunity to drive forward the programme of work to deliver digital services directly to patients and the public. And also it's quite a different approach in terms of the way in which we're proposing to contract and bring in a commercial resource to work with us as an organisation in quite an agile and iterative way to develop the functionality that we need. So I'm taking the two together because there are two contracts, and hopefully you can see from the briefings that they are very closely related. So one is the Digital Applications Partner, affectionately known as P659. That's our procurement reference. You'll see in the documentation there. And the anticipation there is that this contractor will work with us to develop the functionality that we need and to make that available through a mobile application that will be then available to the whole public across Wales, as well as people, specific patients who may have specific requirements from the application. And the other, P660, coming shortly after, is the Technical Development Partner. So the Technical Development Partner we anticipate would develop the environment in which the functionality will be developed. They will look after the kind of data side behind that application and the related programming requirements. So we separated those out in procurement terms when we went to the market, and because the objective was really to find the best of breed in those two categories. So we accepted that it may be that we would appoint two different suppliers, it may be that we would appoint the same supplier, and that's the way we approached that in terms of how we took that to the market. And I should say that we, in this scenario, the governance around this, there is again a specific programme board that was set up to take forward this programme of work under the sponsorship of Welsh Government. And the SRO for that board is Hugh George. So Hugh George actually is a member of the Public Health Wales board. He's the Director of Finance and Deputy Chief Exec for Public Health Wales. So he's a key member of the service who was very keen to lead this board and to drive forward this agenda. And the board includes then a wide range of representatives from across the sector. So the board, again, as with the GP services, the board will have defined the requirements. Now, as I said, in this case, it's slightly interesting because what they've done is define a broad set of requirements, but said that what we want to do is bring on board a partner, do some initial discovery work to understand the art of the possible, if you like, and then on an iterative basis, engaging with our stakeholders, develop the functionality and the solution that moves forward. And that functionality and solution we anticipate will sit on the architecture that Digital Health and Care Wales has developed. So all of the data, if you like, that will be surfaced through the application will be held by Digital Health and Care Wales for a range of purposes. So enabling individuals to see their health record, it's the same health record data that their clinician perhaps would be seeing when they're providing care. So this is very much part of the agenda that the patients are true participants or owners of their care, if you like, leading their care, and then they have all the information ultimately in order to help them to do that. And also the public dimension, I think very important under this programme. It's not just about patients per se, although there is a view, I think, that we may all be patients at one point in our lives. It is about the whole well-being agenda, really, and enabling people to support their own health and well-being, and perhaps so that they are not, they don't need to engage with the NHS or in terms of direct provision of care. So really exciting agenda, bringing on board the two partners. As a result of the procurement, the procurement has actually recommended that Kainos should be supplier of Belfast-based company, if I can say it, should be appointed for both contracts. So they actually scored highest through independent evaluations for both of those contracts, and clearly demonstrated their experience and the synergy between the two aspects as they saw it of the contracts. And Kainos, people may be familiar with, did the development work for the English app. So the NHS app in England, that was actually a Kainos development. They're also doing some relatively high profile work with Northern Ireland currently, again, sort of agile app developments for public use. So they have quite a strong pedigree in that. So in terms of the process for moving this forward, a couple of things that I wanted to just pick up. You will note the Digital Applications Partner, the term for that arrangement looks slightly unusual. It's actually 31 months, the initial period. So the thinking there is that's aligned to the funding position that we've agreed with Welsh Government. We do have the options to extend that. But it is a work package based approach. So you will notice in the numbers we've put an upper value on the potential contract of 7 million. The actual commitment, the initial commitment, is just over 100,000 actually, and that's for the initial phase, if you like, the initial discovery phase, to look at how we take the application forward. as we then move forward, work packages will be agreed on an iterative basis. And I'm sure we're all hoping that that will be very successful, and we'll actually be able to move quite quickly out of discovery to a point where we can deploy a minimum viable product to the public to really engage and get that active commitment in their involvement in the development. So likewise, the technical development partner, same term, has been set out, so the 31 months initially, with the option to extend for a further 2 one-year periods. Again, an upper limit on the contract value, and an initial investment again, which is 114,000, so just over 100,000 for the initial stage. We would reserve the right to take both of those contracts forward, or we could terminate those contracts at any point. So I think this is quite flexible from our perspective to see how that goes in terms of the developments. In terms of where we are with both of those contracts, so they have both, the requirements have been set by the Digital Services for Patients and the Public Board. The procurement approach had been agreed by the board, and the recommendation to award the 2 contracts to Kainos was formally agreed by that board on the 21st of July. The process of acknowledging the contract awards, so both of those contracts have been notified to Welsh Government for their acknowledgement. So I just want to be clear with the board, we haven't received that acknowledgement back from Welsh Government yet. I am expecting it this week, and I've had positive noise that it is going through the process, but we are waiting for that formal confirmation. So the request I'm putting to our board today is that if the board is comfortable to approve the award, it would be subject to that confirmation from Welsh Government, and I would share that with the chair as and when that is received to confirm that he's comfortable that we've received that acknowledgement. Yes, I'm seeking this board's approval now to proceed to award on that basis. Any questions?
Thank you, Michelle. Again, echo Rowan's comments on the first contract you talked to. A very clear run through of the key elements of this and the decisions that's required. And I note the point that you're making in terms of the point about if we move forward to approve it subject to. Rowan, I think again Rowan wants to come in on this one. Rowan, can I just bring you in?
Thank you, Michelle. Great job, and this is really exciting. And Kainos have a fantastic track record of delivering in the public sector. So in the unlikely event, I hope, because they are a high quality supplier, that we were to terminate the relationship, under this contract, who would own the intellectual property for the work done prior? Would we have access to the code base if we wanted to do something else in the future?
Yes, absolutely, key point, Rowan. And I think the other point to note, which I didn't provide in my overview, but we're also hoping to engage a range of suppliers actually in the development effort, so not to do all the development with Kainos. As you say, we're very optimistic that things will progress well with Kainos based on their experience, but we don't want to close the market. So we want to ensure that other providers can develop applications or specific functionality that would then bolt on to the main system. So it's quite an active, and indeed it is an active market, as we know, and we want to ensure that we're encouraging that kind of innovation and development. So yes, IP in the code will be key, and our approach will be to ensure that we have the ownership that we need in order to take that forward in whatever direction we decide to take it forward. Yeah.
Thank you, Michelle.
Excellent, thank you, Rowan, for that question. It's a really important one, and for your response, Michelle. Any other questions or comments, colleagues, before I move this one to conclusion? No, I'm not seeing anything there. So, Michelle, therefore, I'm going to say that the board is happy to approve the award on the basis that you've outlined today. If there is any wrinkle associated with Welsh Government, we'll need to come back to that, but hopefully we can resolve that in the next few days without the need to bring this back to a further board meeting or a special meeting in any way. Okay, that takes us on to our next short comfort break, which I think it's important we take, not least of which for Michelle, because she's back on again as soon as we come back in 10 minutes time. So can I ask that we reconvene at 12:05, please? Thank you. Welcome back, everybody. Hope everybody can hear me and that we're fully live again. We'll move into the next part of our agenda now, part 6, which is a kind of different feel around governance, risk, performance and assurance. And we're going to get into this section on the agenda again. It's a busy day for Michelle. Back to Michelle as our Chief Operating Officer, who's going to take us through the integrated performance report, performance dashboard, and highlight any specific issues that the board needs to think about today. And I think, Michelle, you're probably going to draw a number of other colleagues yes. into different sections of the report. So I will leave that to you to draw colleagues in as you want to, if that's okay. So over to you.
Thank you, Chair. Yes, worth noting, we're looking at the organisational performance report that spans the whole organisation. So as Bob mentioned, I am going to call on a couple of colleagues to perhaps comment in some of the key areas of performance as part of this update. I just wanted to note a couple of things, really. I'm not planning to go through the detail of every page of the performance report. It is there for the information of board members and others. There is a summary at the front of the report. It does note that this is an area that we are working on as a new organisation, and I really appreciate all of the work that the team and the teams across the organisation have put into this. It is very much a work in progress, so I also appreciate any feedback from the board in terms of what it would be helpful to see going forward. And we are continuing to iterate the report inside the organisation as well as we move forward. So I've highlighted in the cover paper some particular things that I wanted to draw out for the attention of the board. Before moving into those particular issues, though, I also wanted to note, and hopefully it does come across in the detail, that our first quarter as a new organisation has actually been very productive, and quite a lot has been delivered and quite a lot has moved forward in terms of the benefits that we're delivering across NHS Wales. So Helen mentioned a couple of key things in her update, and obviously we've had the strategic procurements that we're moving forward to make a lot of progress. I also just wanted to note we've fully launched now the new cyber resilience unit. So this is a key development and provides support again across the whole of NHS Wales, hosted by Digital Health and Care Wales. And also the pharmacy solution. So this is the hospital stock control system that's used in the pharmacies in our hospitals across Wales. The pharmacy community worked really well together to select a solution and to agree a common approach to deploying that solution. And I think we're now seeing the benefits of that in the pace in which we're able to make that available. So Hywel joined the live sites in this period. We've now got 3 health boards fully live. And moving at quite a pace now to complete all of the health boards by the end of this calendar year. So I think Cardiff are next in early August, followed by the other health boards. So it's a really successful project, and I think a really good reflection of working together and agreeing common goals and a kind of an eagerness to move forward at pace and learn from each other and to standardise as far as possible has actually been very successful from a pharmacy perspective. So before handing over to colleagues, I'll just pick up the key points that I have called out in the report. So I wanted to make sure that the board were fully appraised of those. You will notice that there are a number of areas in the scorecard that we've highlighted as amber, and there's some explanation in the cover report as to why that is the case around statutory mandatory training, where we've got a big focus now. We have had some challenges. You'll see it coming across in the report with our electronic staff record system following the setting up of Digital Health and Care Wales and the transition of quite a high number of staff into a new instance of the system. And we're working those through with the supplier to resolve those. Those around the training requirements are now resolved, and I would expect those numbers to be going up. It has been difficult for staff in the first couple of months of the year. You will note I've also mentioned about the appraisal data. I haven't been able to report that for the first quarter, which is very disappointing. And we are working with, as I say, with the supplier to ensure that the next time the board meets that we will be able to understand what that position is. Absolutely key in terms of our support and management of staff. Our standards compliance, so ISO and BSI standards compliance, is showing as amber, not because we've lost any of our standards or we have any concerns about our retaining the accreditation and those standards, which is really key to us, but because we do need to do more work around resolving the corrective actions arising. So a bit more focus around that and our Director of Finance could probably talk to that. She's got a specific team now who are focused on that and are leading that for the organisation, and we've put some additional resource into that team to ensure that, that those issues are addressed. And around contract management, which is actually one of my teams, we've also brought some additional resource in as a result of establishing the SHA, which will ensure that all of our contracts are actively managed. I am not concerned, and I can assure the board that our strategic contracts are certainly actively managed and are regularly reviewed. There are other areas in the programme that we would like to put a bit more focus on, and we will also be providing training and support across the organisation to ensure that everybody understands that. So particularly called out, I mentioned about the appraisal compliance, workforce vacancies. I just wanted to talk about vacancies because this is obviously a key issue for us as a board in terms of being able to recruit to the full complement of staff to deliver a challenging agenda. So as noted in the report, we're making good progress against the targets that we set ourselves for the first 6 months. We're just tracking just below that target at this point, and we've got a good forward projection. I should say that we have had additional funding, and I'm sure Claire will pick that up in her update that's come in, which has meant that the recruitment target has actually gone up, and we will make sure that that's noted the next time we meet as a board, so that we are looking to bring additional people over and above that was anticipated at the beginning of the year. So we will be keeping that focus on recruitment. I know I've talked about that a number of times to board members. We've got a task and finish group who are really focused on ensuring that we push through the process and the focus on recruitment. We've got a wide range of initiatives that we're trying to cast the net very wide in terms of potential applicants and encouraging a wide range of people to come and work with us. And we've employed 3 specialist recruitment agencies to target recruitment for us going forwards. So the final point, and you will note on the plan, we've got one red on the plan, which relates in the first quarter to the definition of the architecture vision, and that's really the setting out, the documenting, if you like, the core architectural building blocks. So we have had some delay in that area in quarter 1, and that is really mainly because some of our architecture resources had to be deployed onto urgent COVID activities. That has now been addressed. We've brought some additional resource into that team supporting the COVID work, so we can ensure that in quarter 2 that should be back on track. We've also been making a lot of progress in that area. So in terms of the API management work, very much on track and key to us in terms of opening up the architecture as we move forward this year, and lots of progress being made in other related areas. So we will keep focus on that area and ensure that we're achieving what we need to. So those were the key points that I wanted to call out. I was just going to bring in a couple of colleagues. So I wanted to call on our Executive Medical Director, Bwrdd Hurl, who's going to provide a brief update on one of the other aspects of key progress in this quarter. Bwrdd.
I can't see the slides, I'm afraid.
So we're not projecting the slides, Bwrdd. It's the Welsh Nursing Care record.
The verbal update on that is that we've had an excellent user engagement. We've rolled out in a number of health boards where we've seen nursing staff take on board the working change practice. There's an excellent video that we can signpost the general public to, which is available, which demonstrates the feeling and anticipation prior to a digital informatics program, the anxiety that staff have across various skill mix and age groups within the nursing community, and then the subsequent after they've done it and how do they feel and what value they think they've added to the delivery of care. The key points are that this digital change is dependent on the infrastructure, so things have to work, and that's a partnership investment at a local level. Supporting users during the process, so an element of what we would call standing at the elbow, hand holding, and not leaving users having trained them once, going back and helping them as they explore the different functionality that's available. Supporting users to understand that just because they used to print stuff off doesn't mean they need to print it off now. And what is a really interesting finding was when nursing staff were transferring patients from one care environment to another care environment, the question they raised is, should we print it off? And therefore the feeling of physically handing over a document as part of that traditional process of transfer of patients. The receiving care environment, the nursing staff, absolutely welcomed for the first time that they didn't have to repeat stuff, that it was legible and visible on electronic systems. And it was very pleasing to hear them say that they had more time to care, more time at the bedside. And there's been some excellent benefits realization through the standardization work. One example being the fact that nursing staff were no longer having to put the demographics of a patient on each piece of paper within the care record. That accumulation of time saved was equivalent to more than 50 working full-time working nurses in a year, and that's just a demographic element. So the fact that we can now avoid the repetition, that we can spend more time at the bedside to care, we can start the conversation with patients from an increased knowledge base, which provides confidence in the confidence to the patient that we know more about them, has really engaged the workforce, and we're moving to wider implementation. And the word and mouth across NHS Wales within the nursing community is this is a success. When can we do the next elements of the care pathway?
Thank you, Ridian. Ridian, can I just follow on that when you said the next elements of the care pathway? What would that mean in practice?
Initially, it means standardizing the thing that you record on paper across all care environments. So to give you an example, Bob, the pain score. So if you want to digitize something, the first thing is to standardize the practice that you have. What the nursing community have been excellent at is getting everyone in a room and standardizing care pathways initially for the acute admission. You might be cited on daycare surgery pathway. Every organisation uses a different form. So standardizing the way that they do it in agreement with the users, that's heavy user engagement, and then digitizing it in a way that it supports the workflow of the care professionals in the patient journey.
Okay, that's helpful. Thank you. Sorry, Michelle, back to you. I think you were going to bring Carwyn in.
Yes, thank you, Chair, and thank you, Ridian. And as noted in the report, the Welsh Nursing Care Record is now deployed in Hywel Dda, Velindre and Swansea Bay Health Board. So the progress on that has been quite rapid. So yeah, just wanted to hand over to our Director of ICT, Carwyn Lloyd-Jones, who's going to update on another key area that he's leading on in relation to our data centres. Carwyn, over to you.
Great. Thank you very much. So yeah, just a quick recap really then. So one of our data centre providers have advised us last autumn that they no longer wish to continue to provide data centre services, co-location space for us. So we needed to find an alternative provision. So we used a consultancy company to quickly develop the strategy for the approach, if you like, that we were going to be doing. And they recommended, and we adopted a hybrid approach. So mainly moving services into a new data centre, but moving some of our workloads into a cloud provider instead. So there's been some good progress over the reporting period. I'll start with the key points related to the physical move. So the work to complete the new data centres, mechanical and electrical systems has completed. So we're talking about sort of battery backups, the generators and the cooling systems that are needed in the facility for the servers to move into. That's been tested successfully with the maximum load that we will be consuming. The installation of circuits required into the new facility. So these are to connect to the NHS Wales network, to link to the hospitals and the GPs and so on, to the internet, and also to our other data centres. The installation of a new local area network, so that's the network within the site. The network at the current data centre is reaching the end of its life, so it was better for us to install a new network in the new facility as well, and the testing of that is underway at the moment. And then we've had considerable changes and tests that have been going on to our current infrastructure and our systems to get them ready for the physical moves, so that we are able to carry out those moves with a minimal amount of disruption to services. And then obviously finally the last bit is a lot of engagement with the various third parties that are involved, so those involved in the moves, the data center providers, and also some third parties that we use to provide fully managed services, and to basically develop that detailed plan for the weekends of the moves. So that's the physical move part. And then the other part, which is there was a chunk of the project was to move services to a cloud provider. So one of those bits was for our internet facing services. So these are things like the websites and the My Health Online service. So all of the DHCW managed ones have now moved, and the ones that are managed by the third parties have either moved or they're underway. So we're almost complete on that part of the work as well. So some really good progress, and we're on track for our physical moves, which will take place over the coming months. That's it from me, thanks.
Thank you, Carwyn. Michelle, is there anything else that you want to draw out from the report before I open up to see if there's any comments or questions from other colleagues? Lost you, Michelle. Canada.
Oh, no, thank you, Bob. Those were the key points I wanted to draw out. Happy to take any questions, or for the team to take any questions, obviously, and to take on board any feedback. Thank you.
No, thank you, Michelle, and to Carwyn and Rydian as well. I mean, I just add, I think, Michelle, you said at the outset that the performance report is developing. It's a work in progress. It's something we've got scheduled in terms of our board development sessions to spend some time on and thinking that through. So colleagues will have a chance to get into this in a lot more detail in terms of the nature of the performance report and the things that we need assurance on, and so on and so forth. And that will happen now over the next few months. But there's a great deal of detail in what you presented to us. And I think as well, Carwyn, just noting that the sort of last issue that you've raised about the data centre move, it sort of starts to open up that broader conversation that the board will be having over the next few months about our longer term cloud strategy as well, and where we're going with that, because we know that's an important development, not just for us as an organisation, but for the whole of the NHS system in Wales. So thank you for that update. I can see one question coming in from David. So David, can I ask you to bring your question, please?
Thanks, Bob. Thanks, Michelle, for the update. One of the actions that came out of last month's meeting was to provide a report on the in-service or in-flight service development programs. We've got a target of getting that done for the next board meeting in September. I just wondered if it'd be possible to have an early draft of that on the 11th of August, when we've got the next Digital Governance and Safety Committee meeting.
I'm agreeing on behalf of my colleagues, David, but that sounds like a helpful opportunity to perhaps review some of that detail and help to shape it as well. So yeah, I think we'll take that offline from today and look at what we can do for that committee. Good idea. Thank you.
Thanks. No, and thank you. Actually, I meant to, David, it jogs my memory. I meant to say at the start of this item, this whole section of our agenda, I think the work that is presented here and is ongoing is clearly underpinned now by the more detailed work and scrutiny of the committees that we've got running. So it's, this reflects the fact that there's a great deal of more detailed discussion taking place away from the sort of the formal board meeting setting today in terms of the work of the committees, which you're all involved in. So thank you. Rowan wants to come in.
Thank you, Bob, and I just wanted to welcome the new reporting and the update on the architecture. I know that we've had to put resource on the COVID response, and I would say nobody would argue with that choice. But it is absolutely fundamental to delivering the NDR, which is critical for so many other projects that we are moving on. So I wonder if the team could go away and look about how quickly we will catch up. So we've now brought more resource on, and I know you said in Q2 we will catch up, but to make sure that you can circulate that through to some of our key stakeholders so that they are aware of the mitigation and response, and commend the report generally. Thank you.
Thank you, Rowan. That's really helpful. So we're developing a couple of short follow-up actions that are coming through from this today. Helen, I can see Helen wants to come in. I'll take one last question on this. Helen?
Thank you, Bob. It's just in response to Rowan's comment then, or request that she raised, and in terms of the National Data Resource Programme, there's a lot of work going on at the moment. We've appointed the new programme director into that programme, and in the August board meeting there will be a broader discussion around kind of the outlining the direction of travel of the programme, because the new programme director has done a review and will be making some recommendations, and I think that all of the plan and what is to be delivered will be picked up by the NDR programme board, and we will share a summary of that with colleagues and with stakeholders as well. But it's a very well attended and very well engaged programme board in the NDR space, as you would expect, Rowan. But we will share the discussions and the outcome of those discussions with the board.
Thank you, Helen, for that clarification. That's really helpful. Okay, so I think that's noting, Michelle, the report. Thank you for that, and to other colleagues who've contributed to it. I'll move us on now to the next item on the agenda. I can see Claire's teed up, ready to go, and invite Claire Osmondson-Little, our Finance Director, to present this month's finance report. So over to you, Claire.
Thank you. Yes, I will go through the highlights of the report, which highlights the financial position of DHCW in its first quarter. In the month, you can see, and it was highlighted in also in the performance report, for the key financial deliverables in the quarter, we are green. What that means is in relation to our revenue, capital, and also our public payment policy requirement, we have delivered within line with plan. In terms of our revenue budget, we were slightly underspent by about 389,000. In capital, we were slightly underspent 167. And in relation to our public payment requirement, which is to pay our suppliers within 30 days, we did that to 97% of our suppliers, which was above the 95% target. I'm also pleased to report that our cash balance is healthy and such that it has enabled us to actually transact our biggest transaction in July, which was the settlement of the Office 365 payment, which I'll touch on later. The SHA transition work for us continues, and we are decoupling our ledgers from Velindra. The work on that is on plan, and again we aim to finish that in September in line with the requests of the audit requirement. There are no notable financial risks for this financial year, and we do note a couple of opportunities, and that's the work we're doing alongside the Digital Pathway Group to optimise the spend in and around the TTP and COVID requirements. I also note the point that Rowan made, which I think highlights the spotlight and the importance of the financial optimisation that we're using in and around the COVID response. So I'll go into a little bit more detail now on each of those. In terms of our baseline revenue position, as Michelle has already alluded to, we are now working hard in the establishment recruitment, but also recruitment in relation to COVID and our digital priority funds activities. Recruitment is progressing well and it has been underpinned by the Workforce Task Force. And you'll see further improvements of that, and we are seeing further improvements as we go out throughout the year, but it is having an impact on our level of underspend in some key areas. Having said that, there was one area of note that was overspent in the month, and that's in relation to what we call our ICT, our Information Communications and Technology Directorate, which is primarily responsible for our data centres, our service desk networks and cyber, amongst other things. Here we're experiencing some areas of pay and non-pay pressures, but we are working collectively to support and offset those pressures. And we're also looking at the long-term implications, if there are any, and those will be considered as part of our IMTP, which will start again in September. From a capital perspective, again, there's 3 areas of focus within capital. The first is our discretionary spend, which is the spend that we control for ourselves. And again, we've started with our infrastructure plans. It will be predominantly this area of focus, and we've started well. We're slightly behind plan, but we have now plans in place for the second half year, which will really ensure that the areas of focus and highest risk will be addressed. In the DPIF, which is our Digital Priorities Investment Fund, a significant part of our other capital allocations, we are progressing well. The focus is really on NDR, but as we've already alluded to and approved some of the commercial related contracts, Q2 will see a kick up in the spend in those key areas, particularly around the digital patient and pathway initiative. And finally, in relation to COVID, again, our system enhancements and developments are progressing well. And again, we see a small capital spend allocation in those areas. In relation to COVID, there are 2 areas of focus. We have the Track, Trace and Protect programme. And as you can see from the graphs, the key drivers in that are relation to user licenses, which again, we've spent some time working alongside the digital pathway team to optimise those wherever we can. And also the vaccine rollout. Again, one of the key drivers in that is the letter and text volumes, and as the graph shows, we are seeing increases and continual increases in that area. And again, those will progress and vary as the programme develops, and they are reviewed monthly through the Digital Pathway Group, which has representations across Wales but also across Welsh Government. Finally, I want to mention DPIF, which is the Digital Priorities Investment Fund. Again, spend has been relatively low in the first quarter, but we are anticipating a step up. And as I already mentioned, a big player in that will be the digital services, patient and public. I should also note that we are awaiting final approval of some schemes from Welsh Government, notably that's e-prescribing, further work on Office 365 and others. And again, as and when they are approved, they will be brought to the board to show progress. And finally, I'd like to note that in Q1, we have spent some time taking the lead and facilitating the national contract, the final year of the contract with Microsoft 365. We have been working closely with health boards and trusts across Wales to make sure the final year of this contract fully reflects the licensing requirements, and I can assure the board that that has been well and actually has facilitated the payment, which has just gone through in the last couple of days. The outlook from a financial perspective remains that at the year end we will balance both our revenue and capital requirement in line with our budget allocation for 2021-22, and we are now starting to consider what the future year requirement will be in line with our IMT expectation, and the team are currently starting work on that alongside the directorates. So for the first quarter of DHCW, I am pleased to announce that we are in line and slightly ahead of where we thought we would be in terms of the financial position. Thank you, Bob.
Thank you, Claire, for that very helpful and concise summary of our position and very positive summary of where we're at. So, you know, my thanks to everybody across the organisation for getting us to this position at the end of the first quarter, because obviously it reflects, I think your report reflects the changing nature of the organisation and the different funding streams that we have, but really how quickly things are changing and how much we might expect those to develop further in the course of the next 12 months and so on. So it's a really helpful report. Can I just ask one before I just open it up, just one very basic question? I should know the answer to this, but I've forgotten it. You know, the public payments policy thing, the 95% target, is that based on the number of invoices or is it based on the total value of the invoices? I can't remember.
I think it's the number of invoices we put, yeah.
That's the target rather than the value. Yeah.
Yes.
Okay.
Yes.
Thank you. It's just a clarification.
Yeah.
Colleagues, anybody else want to raise any questions with Claire on the finance report? If not, we will note that and note the good position that DHCW is in at the end of the first quarter and Claire's assurance in terms of the rest of the year. Okay, I'm not seeing. Oh no, sorry, I'm not seeing anything there. So I will move us on. We're on time, or just slightly ahead of time. Next item on the agenda, I'm going to hand over to our board secretary, Chris Darling, who is going to take us through the corporate risk management report. So, Chris.
Thank you, Chair. Colleagues will recall at the last meeting on the 27th of May that we formally approved as a board the risk and board assurance framework strategy, and linked to that there was a milestone plan for implementation of that strategy as a new organisation. That's been included in the papers as Appendix A. So I'm just going to work through and provide a quick overview of progress in terms of implementation and where we've got to. So milestone 4 within the milestone plan, risk and board assurance training has now been provided to all board members, and we're currently going through the process of taking forward milestone 5, which is considering DHCW's 5 high-level strategic aims or objectives and working through the principal risks to their achievement. In taking this action and milestone forward, we will start to do the assurance and controls mapping work linked to each of those principal risks, with the aim of having a draft board assurance report to come to the September board meeting, which will complete milestone 10. I think the other key milestone that I just want to pick out of that plan is the work to develop the organisation's and the board's risk appetite and how we develop that, articulate it, and then importantly, I think, as discussed at the last board meeting, communicate that across the organisation and ensure that's embedded. So the work to do that has been scheduled in for the 2nd of September. So the milestones are progressing. I just need to give thanks to colleagues for their time and input to the sessions we've run so far. I know a couple of them have been optional and we've had really good attendance, so very grateful for that. And just to note, the Audit and Assurance Committee continue to oversee the implementation of the strategy. In terms of the main body of the report, I just wanted to highlight we've included as Appendix B some information, and I just want board members to consider a number of factors when we think about risks facing the organisation. So thinking about sector, stakeholder, system factors, but also national and international environmental factors. So I will just draw board members' attention to the World Economic Forum long-term global risks landscape, which is included as Appendix B, and the HM Government National Risk Register. I think it's just worth noting the World Economic Forum long-term risks. The top risks in terms of likelihood globally include cyber attacks and data fraud or theft. And in addition, the top risks globally in terms of impact include information infrastructure breakdown and cyber attacks. So I think it's just a helpful reminder of the national and international context within which we're operating within. For those colleagues that want a bit more on those reports, the link is there, and there is an excellent section on health systems under new pressures and consequences of digital fragmentation. So I will try and ensure we bring some of that through committees in terms of understanding some of the context around that. Moving on to section 2.4 of the report and the current DHCW risk profile position. There's 18 risks on the corporate risk register that have been shared within the packs. Page 3 of the report, the heat map, I think, shows illustratively where each of the risks are, and board members should note that 4 risks have been anonymised due to the sensitivity of the information. So that's relating to cyber risks, and they are shown as reference numbers only on the heat map. These risks will be discussed in some detail at the next Digital Governance and Safety Committee on the 11th of August. The chair has asked that we do a deep dive on those risks, so that's planned and scheduled in. Just to give a summary of some of the changes in terms of risks since the last meeting, we've consolidated the CANISC risks into one CANISC system risk. This continues to be the highest risk on our risk register at a score of 20. And I'll invite Rydian in shortly to give a summary of some of the mitigation around that risk. But before doing so, I'll just carry on through some of the changes. We've had one risk has been removed, 026 VPN capacity. That's been removed as a result of de-escalation. 0205, the DMZ internet failure, the risk score has decreased over the last month from 16 to 8 following mitigating actions. And 0228, fault domains risk, has also decreased from a score of 16 down to 20. So I will just pause there, Chair, and just invite Rydian if he wants to comment on the CANISC risk, which is currently our highest risk, and the work going on to mitigate that.
Thank you, Chris.
Thank you, Chris. Bob, I'm presuming I'm on live now.
You're live, Rydian, yeah.
I can't see the button. So the primary objective is to support business continuity for cancer services across Wales. The dependencies are primarily within the Bwrdd Cancer Centre, as colleagues will know that CANISC is a product that started its life in the last century and has been supporting cancer services across the 3 cancer centres to various degrees over that time period. The risks are well known and have been inherited from the previous organisation and were articulated at the National Informatics Management Board when that governance structure was active. We've taken a structured workstream approach to the various elements of continuity of clinical care and the data requirements, the secondary uses data that allows for an understanding of service provision and the support of national audits that is a marker of our outcomes of the services provided for citizens of Wales. The work that the infrastructure team have done to plan the move of some of the infrastructure, as previously highlighted, is on course, and our engagement with colleagues within Bwrdd, both clinical and non-clinical, and the wider cancer services continues and is well supported. We we've managed to deliver and are on track in certain timelines. We've de-scoped some services across Wales, moving and rescheduling those timelines because of service complexity. It's important to understand that CANISC supports cancer services in community, in hospices, in screening services, and in acute and elective care pathways. And we are working with those stakeholders while also implementing the single cancer pathway and PROMS and PREMS programme. So that's a summary of the activity. It's a complex jigsaw, and we're making progress.
Thank you, Rydian, for that update. Chris, back to you.
Yeah, thanks, Rydian. So I was just going to conclude, Bob, by saying board members will note the assignment of committees to corporate risks, as we outlined in the strategy that we talked about last meeting. So I'm asking board members to note the current status of the corporate risk register, note the progress looking forward, the milestone plan relating to risk and board assurance, and happy to take any questions or bring in risk owners as appropriate.
Thank you, Chris. That's very clear, and I particularly welcome the deep dive that you're saying that is going to happen through the next committee in terms of the risk register and so on. That's to be welcomed. I can see a question from Rowan.
Thank you, Chris. And this is a very minor point, but I would appreciate it if we could always include the scale of numbers that we use to talk about risks when we report them out, just for the benefit of the public. So we talked there about risk dropping from 16 to 8. And I think it's just important that that information is there so that the public can interpret the documents. But very minor point. Thank you.
Thanks, Rowan, and a really good point, because yes, we probably do make assumptions that we shouldn't. So just to confirm, the risk matrix is based on a 5x5 matrix, and we'll make sure that's included next time. Thank you, Rowan.
Thank you, Chris. I'm not seeing any other questions coming up from board members. So, Chris, we will note the report and the actions that you've highlighted. Thank you for that. And we'll move on now to the highlight report from Marion Wynne-Jones, our independent member and chair of Audit and Assurance Committee. So, Marion, you give your highlight report.
Diolch, thank you, Chair, and it's my pleasure now to present the Chair's report from the Audit and Assurance Committee meeting that was held early in July. And as you heard Chris outline, we did indeed note the milestone plan for the Risk Management and Board Assurance Framework Strategy, and perhaps just worth highlighting that committee members provided a lot of positive feedback, specifically in relation to the risk and board assurance training that's been provided indeed to all board members already. So really good to note the positivity around that. And we also reviewed and discussed the corporate risk register, noting the changes to that register, the new risks added, as well as risks mitigated and removed from the register. Just to highlight a couple of things then, and I'll take it as read, but we as a committee discussed the IM&T Control and Risk Assessments Advisory Review presented by Internal Audit. It's a baseline assessment summary of risks facing all health boards and the 2 NHS trusts. And the advisory report was very much welcomed as a useful sharing of information and capturing digital good practice and areas for focus perhaps for the future. So we've also agreed as a committee to discuss DHCW's position against each of the good practice areas I identified. As usual, we received the update from Audit Wales for information, and noting that the planned baseline assessment work will be scheduled over the summer. And we approved the request to close 6 of the actions on the DHCW audit tracker, noting positively that all the remaining audit actions are currently on track to be delivered within the proposed timelines. We welcomed the update report on the Welsh language scheme and noted the timeline presented to develop and also to go out to consultation on the Welsh language scheme for DHCW. Just one other thing then to highlight, we welcomed the annual quality plan for 2021-22, approved that plan, and welcomed the key role that the quality and regulation will play within the board going forward. And then finally, briefly, the estate's compliance report was noted specifically in the context of the Green Health Wales agenda and the government's commitment to a new 10-year Wales infrastructure investment plan for a zero carbon economy. And we were pleased to note that there's been a reduction in the levels of the board's carbon usage to date. Before I hand over to you, Chair, I'd just like to extend my thanks once again to Chris and to the governance team for the excellent support that the committee has received. Diolch.
Thank you, Marianne, for that, for your highlight report. I will pause just briefly to see if there's anything that any other board members want to come in on, any points of clarification or any questions. No, if not, we will note the report. Thank you, Marianne. That takes us on to the update report from the Remuneration and Terms of Service Committee, which is for me to run through. We've already touched on, I think, these items during the course of our meeting so far, but just for the record to note that the Remuneration Committee meeting on the 1st of July approved the appointment of our associate board member trade union, Andrew, who I welcomed before. Following the open competition for the appointment of the chief executive, obviously we reported previously Helen's success through that process, but the Remuneration Committee formally ratified the appointment of Helen as our Chief Executive Officer at its last meeting and approved the remuneration and terms of service, which are in line with the Welsh Government framework and the assessment for this particular role. We also had a detailed discussion about Helen's early thinking in relation to the executive structure, which was followed on with a further independent member briefing. So there's been quite a lot of dialogue and debate with Helen in terms of the finalisation of the proposals around the executive structure, which Helen took us through earlier. And I think it's appropriate just to highlight that we did have a discussion there, which was in recognition, I think, of the significant workload on executive colleagues during this period, not just with the normal things that they have to do, but continuing to support COVID pandemic response, and also the significant development work associated with bringing a new organisation online. So we do recognise the importance of getting the executive structures complete as soon as we can, and the need potentially to consider other ways of supporting Helen and the team during this interim period while that process runs through. So they were the key issues from the remuneration committee. Which takes us, unless anybody wants to come back on any of that, I don't think I'm seeing anything. It's to note the highlight report then, please, which takes us on to the closing matters for the meeting. I haven't been advised of any other matters of urgent business. So again, unless somebody flags something very quickly, I'm going to assume that we don't have any. Which then is the final thing for me to do is to note that the date of our next formal board meeting is on the 30th of September. And with that, I would bring the meeting to a close and to thank everybody for their participation in the meeting today. Diolch yn fawr.